One of the major issues that people have with weight loss and with aging in general is deterioration of the neck. And you can easily tell someone's age or if they had a massive amount of weight loss by the condition of their neck. And this is something that can be avoided, so you can kind of preserve the tightness in that tissue. But at some point, if there was an extreme weight loss, a rapid weight loss, and we see this, of course, with the GLP-1 agonists, people lose a lot of weight fast, and there is a lot of muscle wasting, unfortunately. But 50% of the weight loss is muscle, and that involves the muscles of the face and muscles of the neck. And then sometimes we call that Ozempic face. These are all things that are, of course, not cosmetically very pleasing. But again, there's things that we can do to prevent this, and there's also remedies afterwards. So when we subdivide this, we look at the muscles of the neck here, and that's, of course, very important. You get the platysma and the sternocleidomastoid, and in the anterior section here, those are the most predominant muscles there. One thing that we should do, especially when you're on a weight loss protocol, is, of course, optimize your protein to prevent muscle loss as best as you can, but exercise these muscles as well. Now, this is, of course, only if you're healthy to do so. If you have any neck problems, you have to be careful with neck exercises. So always ask your physician about this first. But simple exercises, the two exercises you can do is, of course, when you're lying back, you use a weight plate on your forehead and you do these kind of exercises where you activate the anterior part of your neck, and then you can use a harness where you hang a weight off the front and you're on a bench and you train the posterior part of your neck there, right? These are the things that you can easily do. These two exercises are sufficient. You only have to do this about once a week. But again, only if you're safe to do so. We don't have any cervical spine problems really, or any impingement there, or any herniation. And if that's the case, I would definitely recommend to do that continuously, no matter what. Even if you're not wanting to lose weight, having a muscular neck is very important. As we get older, muscle wasting occurs everywhere. Muscle atrophy is very common with aging, and deterioration of the neck is sort of a sign of aging. You see, younger people usually have better developed neck muscles, right? And as we get older, getting more complacent, but also due to general atrophy of muscles, this really decreases and the neck shrinks down. And that's not a good thing, because the overlying tissues then will become more sagging, actually. So one way to prevent the sagging is to keep the muscle tone there. The second thing, of course, is preventing that area from UV exposure. I'm really not a big fan of sunscreen. The only sunscreens I really recommend are the physical sunscreens. So we're talking about zinc oxide and titanium dioxide. Those are okay in small amounts, but I use them on my neck because that's the area that you're always exposed to sunlight. I use it also, especially since I wear a lot of V-necks. I hate stuff that's tight on my neck. And to prevent that skin from too much UV exposure, that's actually fine to use. So in the posterior part of your neck, and of course anteriorly here, you can use a zinc or titanium dioxide sunscreen. I just put that on after shower in the morning, and that's an easy thing to do, because really that is a very sun exposed area. And from UV radiation, that certainly can contribute to breakdown of collagen. It can contribute to skin aging and makes everything even more saggy and makes the skin look older. So again, this is one of the hallmarks where people look at you. They look at your face, they look at your neck, and that tells them a lot about your age, So these are, again, the strategies to prevent deterioration of the neck is to exercise, then use a good amount of protein intake if you're healthy to do so. 0.8 to 1 gram per pound of ideal body weight is usually what I recommend. And then, of course, wearing sunscreen to protect that area, very importantly. So what about above the neck? So the musculature of the face, can we do something there? And the answer is you absolutely can, and you should, actually, because again, muscle atrophy happens everywhere. And as muscles atrophy, everything is shrinking down, the overlying skin becomes saggy, and that's definitely a hallmark of aging. And again, with weight loss, this can be really amplified, unfortunately. But the big muscles here, the muscles involved in chewing, are the masseter, then you get the pterygoids and the temporalis up here. And the temporalis is interesting. That's the muscle that sits up here. And you see this in elderly people that really don't chew much anymore. They get this sunken in area up here, and they get sagging down here. They get these jowls. And that's something that you can prevent by training this regularly. I use a device, and I've talked about this previously quite a bit. This one here, the Facelifter. So this has 2 silicone pillows that sit between your rear teeth, and you do very controlled exercises, small biting motions if you want. You compress it only to the point where you can't compress anymore, hold for about 10 seconds, and then slowly let go to the point where you still have tension in these muscles. And then you repeat. So that's 1 repetition. And then you do about 30 to 40 repetitions once a day. I do this under the shower, very easy to do so I don't forget. Once you know how to use it, you don't need to do this in front of the mirror again. You can just do this in the shower, in the car, wherever. But a device like this is actually very helpful. So this one here is called the Facelifter, something that I developed about 15, 20 years ago right now, I think. And I use this daily. I think it's a great device. And again, it really trains these muscles here. It really helps you keep your jawline, prevents any sagging here, And as you get older, that's kind of hard, For me, right now I'm 56, so of course I have some lines everywhere. I don't use fillers, Botox, all that stuff. The only thing I actually use is this device here, and then I do exercise my neck. I think that's actually very important. Now, I started exercising my neck not just because of these issues I talk about cosmetically, but because I had a lot of neck injuries. So when I was younger, I did a lot of martial arts and I had a lot of neck injuries. And so I started exercising my neck in order to actually improve mobility and stability of the neck in order to prevent further deterioration of the cervical spine. But again, these are very important and easy things to do. So exercising these muscles, and then, of course, exercising the neck, preventing the deterioration of the skin from UV exposure through sunscreen, right? These are important steps that you can actually do. And it's an easy one to implement. But these are important things because when people, again, look at you, these are some of the hallmarks of aging is your face and your neck. And there you can do quite a bit, Again, keep in mind, if you use a GLP-1 agonist, I'm not a big proponent of them. I know they're very popular right now. People use them. My concern is the rapid weight loss, the muscle wasting, but also, of course, the black box warning that comes with it. And of course, the host of side effects, including nausea and all that. But most people on GLP-1s, in my experience, because I see some people in my clinic that I switch to different medications, have an issue consuming enough protein. And that's partially because they feel nauseous. They don't feel very good when they're on this. So that's just an aside. For some people, it's a great fit. I'm not saying this medication doesn't work for anyone. I think there are people that tolerate this very well and works well for them. That's great. If that's you, that's absolutely fine. Just keep in mind, really work on keeping muscle mass. Very important. As we get older, one of the worst things that happens is muscle atrophy, and we really have to work against that and compensate for that. And especially when it comes to the face and neck, because again, that's what people look at first when they see you, and they sort of can gauge your age on those parameters.